Hello and welcome to another special episode of MindSpeak presented by Herald Global. I am Saimik Sen and joining us today, the Director of National Institute of Nutrition at the Indian Council of Medical Research, Dr. Hemalatha. Dr. Hemalatha, thank you so much for taking out this time and welcome to our show. So I would like to begin by asking, how has the pandemic affected you personally and professionally?
Pandemic did affect many people's lives. Of course, personally, I did learn a lot. And I also could see a lot of good in people. It was really heartwarming when I saw individuals rising up to help stranded people with food and shelter, and some were arranging foods to be delivered to old couples. Not only individuals, some organizations also came forward. But professionally, it was very, very hectic. And in the process, I really learned a lot. And my team at National Institute of Nutrition, Indian Council of Medical Research, also came up to this demand and supported me in all kinds of endeavors. Like, for example, we played a very, very crucial role in conducting surveys. Nationwide surveys were conducted, and so far we have completed 3 surveys to assess seroprevalence in adults. And now very shortly, we are going to take up the 4th survey, which will be assessing seroprevalence among children from 6 to 18-year-old. And we also established vaccine center. And I was part of interministerial central team where I visited various quarantine centers, containment zones, testing centers to see the facilities and whether they follow guidelines or not, the stipulated guidelines by ICMR. We assess the availability and training of doctors and paramedical staff, availability of kits and various other things in different states. So this also, in a way, very hugely contributed, and we published many guidelines on nutrition and immunity, nutrition and infection, and created some videos to support people, like how they can prevent infection. Then our N9 also worked as a depot center for ICMR, where we used to procure and supply kits and reagents and testing reagents to various hospitals and testing centers.
Okay. So my next question to you is, what has been the impact of nutritional supply due to COVID-19?
You must be aware that India has very good nutrition programs in place, like integrated child development services, and then we also have midday meal program schemes and all. Various nutrition supplemental programs are there in place. Of course, they did get affected very badly because everything overnight, the system got affected overnight. Nevertheless, several state governments and many other organizations came forward, and I have seen personally, and when I went to conduct a survey and when surveillance was happening, I could see various organizations, including various state governments, making arrangements to deliver vegetables, fresh vegetables and fruits right to the doorstep of people.
Sure.
Here, lakhs of minivans and tricycles and auto rickshaws were used, and about thousands and tons of vegetables and fruits were delivered this way. And some places, helplines were set up, where people in distress could call and ask for supply of certain vegetables and fruits. Such things were also there in place. And for this, the municipal corporation helped a lot, and police personnel also helped a lot to the government in making this endeavor possible. Then special teams were constituted in the country to ensure delivery of these items.
So what is the difference between the rural and urban nutritional needs during the pandemic in India?
See, generally rural or urban people, nutrition needs are same. But what I understand is what could be the difference in the way they got affected due to this pandemic.
Sure.
Probably that is your question. See, we do not have a proper research in place which can answer this question. But a report compiled by Hunger Watch showed that large section of rural residents were not affected because of a blow of this pandemic driven economic disruption due to food grains via the public distribution system. The government ensured that the PDS goes on well, food grains were given. So that way it did take care of most of the rural people living in rural areas. But the same paper says that urban poor's access to such ration was little affected and adversely affected.
Okay, you mentioned children in your survey. So my next question is, what are the utmost importance of food guidelines for children during this time, especially?
They remain indoors and physical activity may be a problem. Yes, the first and the foremost thing is avoid fatty foods. Avoid foods that are high in sugar, particularly bakery items where whatever you buy there will come with lots of salt, sugar, and high in fat and very little nutrients. Nutrients means in the sense vitamins, minerals, etc. Then avoid fruit juices because fruit juices are just namesake fruit juices, but they contain hardly 8 to 10% of actual fruit in them. Then cool drinks, protein drinks and shakes. Then I would definitely ask them to moderate salty snacks, moderation in salty snacks, and also resort to complex carbohydrates rather than simple carbohydrates like refined maidas and refined rice and all. Then the most important thing to keep in mind is variety is the key. Try to source your nutrients from varieties of cereals, varieties of pulses, varieties of vegetables and fruits, not just go to a single type because all nutrients are not present in one food group or one food for that matter. So, and then regular indoor physical activities as much as possible should be, should be followed by children at home. And also parents can oversee these things. Yes?
Sure. So there are so many immunity boosters which are available in different retail right now. So according to you, what would you recommend as an ideal immunity booster?
See, there is no magic bullet. A wholesome, balanced, carefully planned diet is crucial for optimal immunity. Food not only helps immune response, it also helps in controlling inflammation. And you know very well, inflammation is a major problem in the current COVID infection. Many people suffer from heightened inflammation, and a good plant diet where you get good amounts of zinc, vitamin C, vitamin D, selenium, vitamin E, and many other micronutrients help control inflammation. And also, these vitamins and minerals help scavenge free radicals. Free radicals, oxidative free radicals, are produced in huge amounts during any active infection and when there is also active immune response. So these free radicals must be removed from our body as and when they are formed. And vitamins and minerals that go along with fresh fruits and vegetables and whole grains help a lot in removing these dirts from our body. So wholesome, balanced diet is the key for optimal immune response. And this wholesome, balanced diet also helps in appropriate response to any vaccine. COVID-related vaccine as well, and also appropriate formation of memory because the immune system should remember the pathogen, and the second infection will be controlled better if there is appropriate memory.
Okay. So do you think women need specifications in nutrition as they are under more stress in a work from home condition? Because most of us are working from home actually.
Yes. Most women in India are either overweight or underweight or even micronutrient deficient. And added to this, they are under more stress in a work from home condition, as you rightly mentioned. Yes, complex carbohydrates such as whole grains, fruits and vegetables, which contain complex carbohydrates, not the simple ones, can induce the brain to increase serotonin. Research has shown. So it increases serotonin production, which stimulates a feeling of calmness. So it is very, very ideal to go for a good diet like complex carbohydrates, whole grains, fruits and vegetables. And also it is suggested that they consume vitamin C rich foods like citrus fruits and all, because again, this is known to reduce stress hormones and boost immune response. Then green leafy vegetables and amaranth, spinach also is known to have lots of magnesium and other minerals, which also help in improving sleep quality. Then also this omega-3 fatty acids that are there plenty in a little bit in nuts and seeds, and also it comes in fatty fish, marine fish. So these also help in reducing stress hormones and calm the mind. So, once again, the point is, you have to resort to wholesome plant, good diet, healthy diet. So healthy diet is again the key to overcome stress. And also adequate physical activity. Physical activity also helps a lot in keeping your mind calm. So regular moderate physical activity is also important.
Okay. So with cases of black fungus, white fungus, yellow fungus on the rise, so what should be avoided in the diet?
See, these fungi come from mucormycetes. It's a group of fungi that causes mucormycosis, all this white, black, and yellow and all.
Yes.
I mean, it is ubiquitous. It is present there in the environment, in the soil, in the air also, mostly in the soil. This kind of is present in the soil. Mostly, all of us, I mean, most of us get exposed to these fungi, but we don't develop infection because we have a robust immune system. Day in and day out, we might be exposed, but we don't get infected. The reason now there is epidemic outbreak is during the COVID infection. I mean, as such, people are becoming immunosuppressed because of inflammation. And if they are diabetics, again, if the sugar is not controlled, their immune system is compromised, again, they can develop. Again, it is also shown that COVID itself can destroy the beta cells and cause a spike in sugar. So increased sugar level in your blood can predispose to mucormycosis, and also uncontrolled use of the steroids where it is not indicated. I mean, because of panic, people are driven by panic, and I mean, they feel that COVID infection will cause a lot of severity, and I mean, they resort to all this kind of this thing where steroid is not indicated, but they take large doses of steroids, which will again compromise your immune system and can increase infection. So this fungi as such will not cause infection, but it can cause infection when there is immunocompromised situation, and it doesn't come from food.
So it has nothing to do with, like, maintaining any kind of a diet as such.
No, I mean, if you have, if you follow all the food safety norms, like cleaning your hands, keeping, eating fresh foods and all this, that should be sufficient enough. It doesn't generally come from food. You have to wash your fruits before eating them. You have to wash your hands before handling food. All these norms are known, and one has to follow. But definitely food does not transmit this infection.
Sure. So what is your role in the task force called Food and Safety Standards Authority of India?
Oh, we at NIN, all the scientists in NIN play a very major role. NIN is a solution provider for many health and nutrition related food safety issues in FSSAI. Scientific panels and committees of FSSAI rely on the data produced by NIN. Like, we have this Indian food composition table, then where micro and macronutrient contents are there for various foods. This data set is there. Then we have nutritive value of Indian food, then recommended dietary allowances, where we propose how much an individual should be eating based on his weight, physical activity, gender, and physiological stage. So these recommendations and guidelines are used very widely by this particular, not only this particular authority, but also several other ministries. Then many scientists of NIN contribute as members and chairperson of FSSAI scientific panels. The food labeling regulation is also constantly being upgraded with data that is provided by us, and also the intellectual inputs coming from NIN.
Okay. So do you think the government needs to introduce more schemes for nutritional needs for the populace? Do you have any plan in place for that?
Yeah. See, the government of India already has robust and effective, very good schemes in place. I mean, you know very well, ICDS is there, MDM is there. I mean, iron folic acid program, then vitamin A supplementation many nutrition programs are there in place, of course. But the problem is, I mean, there should be evaluation of these programs, effectiveness, and regular monitoring also should be in place to assess implementation of these schemes. But during the pandemic, the government did have certain schemes like for laborers and migrants. The central government and the state governments also have arranged cooked food supply 3 times a day. They used to supply meals 3 times a day to the labor camps and various other camps where people were put under shelter. And also free rations were given home. So such arrangements were, I saw it, I mean, not only foods, but also tea supply was made possible, right, in the morning and in the evening. So such emergency schemes were there in place during the pandemic. And most often, I mean, these schemes took care of the food security of most people, but we do not know, but in certain corners, probably the food grains couldn't reach, or the fruits and vegetables couldn't reach. I mean, these are all huge tasks. As much as possible, the governments and many other organizations and individuals put in a lot of effort to see that people are made people don't go hungry and they are made comfortable by giving shelters.
My last question to you, what would you like to tell people in order to contribute towards food safety in the country?
These are the norms well known to most people. At least during the pandemic, most people learned a lot about food safety norms. Wash vegetables and fruits thoroughly under running water. Do not apply disinfectants, sprays or sanitizer directly on fresh produce, because spraying chemicals on vegetables and fruits makes them all the more harmful. And wash and clean the meat under running water, after handling fruits and vegetables. Then when ordering food from delivery platforms, use contactless delivery option, that is best, where food packages are left outside. Then carry sanitizers wherever you go when you go out to purchase food. Always buy fresh fruits and vegetables and not those that are bruised and damaged. Then sanitize your hands after handling food packages and discard them appropriately. Then do not handle food when you're unwell. That also is very, very important point. Even at home, when you're not well, do not handle food. And wash your hands before eating, before feeding children, and wash your hands after handling foods.
Thank you so much, Dr. Hemalatha. It was very informative, and it's a lot of information that we gathered today. I'm sure our audience will get a lot of help out of it. So thank you so much.